Hi, my name is Dr. Ray Benedetto, and I'm the author of this groundbreaking free report, How Thousands of Fibromyalgia Sufferers Are Finally Melting Away Their Chronic Pains and Fatigue Without Drugs or Surgery, and how you can too. I also work with Dr. Michael Johnson, the author of this book, What Do You Do When the Medications Don't Work? A non-drug treatment for dizziness, migraine headaches, fibromyalgia, and other chronic conditions. I've been practicing in Bethlehem, Pennsylvania, in the Lehigh Valley, since 2003, helping hundreds of patients just like you with fibromyalgia, chronic fatigue, chronic pain. What makes me different than any other doctor that you've ever seen for this problem that you're having, for this condition? What we do, and what we're going to be talking about today, is we treat patients very differently. We treat patients both metabolically and neurologically to help them get better. And that's what we're going to be getting into today. If you're watching this video, this DVD, either yourself or a loved one is suffering from some type of chronic condition, whether it be fibromyalgia, chronic pain syndrome, chronic fatigue syndrome. And what I want to talk to you about today is how we can finally end that fibromyalgia, that chronic pain nightmare. And we're going to be taking a few minutes going over what we do, how we get patients like yourself better, what are the steps that need to be taken, why haven't you gotten better to this point? Why, in spite of all the doctors you've seen and all the drugs you've taken, why hasn't this problem resolved itself? And what we do to really get to the bottom of these conditions and really find out what is going on with the person that has these conditions and what we can do to help treat it. What we can do to get them better, to get their life back. It sounds simple, but really what we do is to find the exact cause of what's going on, we need to leave no stone unturned. We need to look under every rock. And most of the time, by the time patients get to me, they just haven't had someone take the time to do a thorough enough job at trying to figure out what's wrong with them. They haven't had the right tests run. If they have had the right tests run, nothing was acted upon, nothing was done with those results in order to help fix what's broken or what's not working. They haven't had the complete package. They haven't had all the correct testing done, and then they haven't had the treatment that's needed to fix it. And that's what we do with our patients, and that's what we're going to talk about briefly today. So I want to thank you for taking the time, and I want to congratulate you for taking the time, because this short video is probably going to be one of the most important things you ever watch to help you get better, to help you finally get back to being you. Now, what I want to do is I want to go over what we do, how we do it, and see if you think it might be something that would work for you. At the end, I'll even invite you probably, if you would like to contact our office for a consultation. If you like what you hear and you think that this might be something that can help you, we'll invite you to call the office and see if this might be something that we can work together in helping you with. Now, let's go ahead and just dive right in. What we want to talk about first is, again, we treat patients metabolically and neurologically. That's huge. I mean, that's the missing link for most people. Now, metabolically, I want to get into some things. There are many different tests that need to be run. I guarantee you haven't had most of these tests run, and that's the problem. That's part of the problem. Why you are like you are today is because you haven't found a doctor who knows what they're doing, who knows the proper tests to run and knows what to do. Now, what are some of those tests? What do we do? What are the things that need to be done? The first thing we do, which is huge, which is absolutely huge, is we do some sensitivity testing. Now, we have a couple different tests that we run. We do some blood testing to look for sensitivities. We use a laboratory called Cyrex Labs. You can look them up if you like, cyrexlabs.com. And we use another company called EnteroLab. And what we look for, especially with the sensitivity testing, are different foods that you may be sensitive to. very commonly with patients with fibromyalgia, chronic fatigue, they may have a sensitivity to a certain food. There are certain foods that we look for. You may have even heard of some of these foods. They're getting relatively well known. Things like gluten, which is in different types of grains: wheat, rye, barley, oats. Milk, eggs, soy. These types of foods, if you have a sensitivity to them, are going to, if not causing, significantly making your condition worse. I highly doubt you've been tested for all of them, if any of them at all. What are some of the symptoms you can get if you are sensitive to these foods? Chronic pain, fatigue, all kinds of digestive problems, whether it be diarrhea or constipation, all kinds of ulcers and sores in your mouth, chronic yeast infections, all these kind of things that patients suffer from. And if you have one of these sensitivities, we need to get it fixed. We need to find out if you are sensitive to these foods, and then we need to remove them from the diet. It's as simple as that. If we do the testing and you have a sensitivity to these foods, you can't eat them. If you have a gluten sensitivity, then you cannot eat grains that contain that particular molecule. Now, as an aside here too, this is part of what helps me determine whether I'm going to accept a patient for care. Patients need to be willing and able to make the changes that need to be made if they want to get better. They have to be committed, because I'm committed. I'm going to do everything I can to help you get better and to figure out what's wrong. But this is kind of where the rubber meets the road with a lot of patients. Is we do these tests, and I'll get patients tell me, well, I don't know if I can stop eating grains. I love my breads, my pastas, and I'm not going to give them up, or my milk if it's a dairy issue or whatever. And then we're probably not going to work together. Patients need to be serious about getting better, because we're serious about helping them get better. So this is all part of you need to be committed. If it's things that you can't do, don't even bother calling my office. We will work together if we can help, sincerely help, and we think that we have a really good chance of helping you get better, but also if you're willing to take the steps and do what needs to be done. And a lot of times it may be things you don't want to do, but it's important to helping investigate the problem and helping to get it fixed. So sensitivity testing is huge, because it's very common with patients with fibromyalgia, chronic fatigue syndrome, chronic pain syndromes, things like that. One of the other tests we run is called an adrenal stress index. Okay, your adrenal glands. 2 glands, they sit on top of your kidneys. They are your stress glands. When you are stressed, whether that be a physical stress, an emotional stress, anything, some kind of infection, whether it be acute or whether it be chronic, your adrenal glands are called into action. And they release things like cortisol, epinephrine, different molecules, things called catecholamines, which are cause a lot of inflammation. They release things into the bloodstream that help our bodies respond to stress. They also play a vital role in helping to regulate our blood sugar, along with our pancreas and the insulin, and everyone knows that story. So, if you've had this chronic problem for years, for a lot of patients, and no one has checked these adrenal glands, there's a good chance they're not working right. And we need to find out if they're not working right. And the only way we're going to do that is if we test them. We use a lab called Diagnostics. It's a salivary testing. We use spit, and we can check the levels of these adrenal hormones and see, are your adrenal glands working properly, yes or no? Because if they're not, we got to get them fixed. But we won't know until we test. I'm pretty sure you probably haven't had those tests done. Most patients have not. We need to do immune testing. We need to check your immune system. What I find commonly with patients is that they may have an autoimmune disease, and it has been undetected. They may have even had some blood tests for things like rheumatoid arthritis or Lyme disease or any number of immune diseases that exist. So we need to check your immune system and see if it's working properly. There's 2 sides to your immune system. There's a Th1 and a Th2 side. They need to be balanced. They need to be working properly. If they're not, or if you have some kind of autoimmune disease that no one has picked up, it's constantly attacking your body. It's attacking your brain. It's attacking your thyroid a lot of times. It's attacking your digestive tract. So we need to figure out, do you have an autoimmune problem there that's, again, maybe causing this whole problem that no one has picked up on? We have to check for these things. We find them very commonly. And if you have an immune disease, if you have an autoimmune problem, there is no cure for it. You have it. What we can do is we can treat it and get your immune system working normally again, get it back to normal, to help get you feeling better and give you the tools to manage it and to know what to do about it. We have to do it. That's huge, because if you have an autoimmune problem, it needs to be addressed, or else nothing else we do or anyone else does is going to work. We check for things like intestinal permeability, leaky gut syndrome. If you have any of these problems going on over a long period of time, there's going to be damage done to the lining of the digestive system. And again, that needs to be fixed, because that's going to be triggering these immune problems. Because your immune system, there are now things getting into your body that shouldn't be there, and your immune system's going to attack them. So if that's triggering or stimulating this immune response, again, we need to get it fixed. We need to get it fixed if you're going to get better. Hormone panels, especially with female patients, we need to look at things like estrogen, progesterone, all these different hormone levels, depending on what stage in your life or what age you are going to be in flux. And again, if we have hormone issues, we're going to see things like depression, we're going to see things like fatigue, we're going to see mood swings, sweating, all these things that most people know and associate with hormone issues, but can also be part and parcel or go hand in hand with a lot of the symptoms of fibromyalgia, chronic fatigue syndrome, those kind of things. So we need to look at these things. Blood labs. We obviously do run blood tests. A lot of patients obviously have already had lots of blood tests done, and they've been told your values are normal. Let me just take one moment to talk about blood tests. Lab values. When you go for a blood test and the laboratory gives you the results or gives your doctor the results, those values are very broad. For instance, your thyroid. Thyroid's we find a lot of times a problem with patients, and they don't know it, or they do and it's just not being managed properly. Thyroid values, TSH for one. Very broad values according to lab ranges. We want to see them in a much tighter area, a functional area. Okay? So what happens with blood labs, which is why you've been told this in the past, they have these big broad values. We run the tests, they run a bunch of tests, they come back, this is going to sound familiar, I'm sure. Look, your values are normal. We don't know what to tell you. Try some of these, try this medication for depression. Here's some Cymbalta. Here's some Lyrica. It's all in your head. You've heard these things. I know you've heard these things. And the reason why is because, number one, a lot of times the blood labs that needed to be run weren't run. So we've obviously run things like blood counts, and we need metabolic panels, we need thyroid panels, we need all these inflammatory markers. We need a lot of tests that are run, and a lot of doctors just don't do them as a matter of practice. So we need to do a thorough job in running all the tests that need to be run. And then when we get those values, we need to interpret them properly so that we can figure out what's going on here. We can figure out what's wrong, what's causing the problem. So these are all important tests, and like I said, by the time patients get to me, they just haven't had them done. And they need to be done. If you're going to get better, I can't sit here and tell you what's wrong with you because I haven't run the tests. I tell that to patients all the time. I don't know what's wrong yet, specifically because we haven't run these tests, and you haven't had them done, and you're not going to get better until this is done. That's the only way we can know. So we need to look at you from a metabolic standpoint. What we also need to do is we also need to look at and treat patients from a neurological standpoint. So we need to look at how is their brain working? How is their central nervous system, their brain and their spinal cord functioning? That's the other half of this equation. Because primarily, at its core, fibromyalgia and chronic fatigue syndrome are neurological issues. There's nothing wrong with your muscles, there's nothing wrong with your joints. They hurt, but there's nothing wrong with them. You've been to the rheumatologist, you've been to the neurologist. They've checked you out and they can't find anything wrong. Because there's not a physical problem with those areas, it's in the brain, how the brain is working and how the brain is perceiving what's happening in your body. Okay? So what we need to do is we need to examine and evaluate you properly with a very thorough neurological exam. Okay? That's done here in the office. You're not going to get stuck with needles or put in MRI machines or anything like that. We need to do a thorough neurological exam and look at your entire brain and how it's working. Okay? Once we figure out what's wrong, then we treat you with neurological protocols. Okay? Oxygen therapy. We use oxygen therapy with patients. Your brain needs oxygen. It needs two things to work. It needs oxygen and it needs glucose, blood sugar. That's it. Those are the only two things your brain can use to function, to live. As we age, we lose the ability by about 1% per year after the age of 25 to absorb the oxygen that we breathe. So by the time you're 50, you've lost 25% of the ability to absorb the oxygen you're breathing. So we do oxygen therapy. We need to get oxygen and fuel to the brain. We need to get gas in the tank so that we can drive that car. What we also do, both in the office and at home with patients, a lot of times, is we do what we call brain-based therapy. Different treatments to help stimulate the parts of your brain that aren't working right. That's why the exam is so important, is we're going to do a thorough exam to figure out what's not working right, just like we do the test to figure out what's not working right. And the parts that are broken, we need to stimulate them to get them working properly. So we do a variety of different brain-based treatments. It may involve vibration or auditory stimulation, hearing, visual stimulation, olfactory stimulation, smelling, different types of adjustments that we do in the office, one-sided adjustments to your arms, your legs, your spine, whatever needs to be done to get the job done. Once we figure out what needs to be done, we can use our brain-based therapies both in the office and at home to get you better. So we need to do both. There is no one or the other. Both have to be done because both things are at play. We need to get it handled. At this point, what you need to do is ask yourself a couple of questions. Okay? How has this condition affected your life, your job, your relationship, your finances? I know most of the patients I see, they don't have much of a life anymore because this has taken over their life. They can't get out of bed in the morning. They can't play with their kids. They can't get to their job. Just getting through the day is a struggle because of what they're experiencing. What has it cost you in terms of time and money and happiness and sleep? Where do you see yourself in the next couple of years if this isn't taken care of? I mean, I've had patients tell me they don't even want to think about it because they don't know if they're going to be here because they just can't do it anymore. They can't live like it anymore. And what is it worth to you if we could get this condition improved? And patients will ask me that all the time. Well, what does all this cost? Like, do you take insurance? We do. And here's the bottom line of it, really, is yes, we take insurance. And it depends on the particular patient. It depends on the particular plan. But sometimes insurance isn't a whole bunch of help. Sometimes a lot of these tests might not be covered. Sometimes some of the treatments we do might not be covered. The labs especially, a lot of the labs that we need to do are very specialized and some of them aren't covered by insurance. And I mean, depending on what we need to do, they can cost money out of pocket. Anywhere from sometimes $500 to $2,000 to get the labs done. So, and this all comes back to what I talked to about in the beginning is nobody's going to work harder than me and my staff to help get you better, to help get to the bottom of this, and to help do what needs to be done to get you better. And the patient, you need to have that same commitment. And that may involve doing things you don't want to do. And that may involve coming to the office for treatment. And that may involve out-of-pocket expenses for things that aren't covered. And if that's a significant problem for a lot of people, I just tell them, then our treatment is probably not for you. Our office is probably not for you. Because sometimes that's what it takes. And we're going to do whatever it takes. And I'm going to ask you and my patients to do whatever it takes. And those are the patients that we work with. So if patients have trouble doing any of the things that I'm talking about today, then you're probably not going to be accepted for care in our office. It's just the bottom line. I don't mean to be mean about it. I don't mean to be rude, but that's just the reality. We're very serious about what we do, so we only work with very serious people who want to get better, people who want their lives back, because we can do that. Because that we can do better than anyone you've probably ever seen. Here's what I want you to do next. If you're serious about getting better and the possibility that, look, what we do could help and has helped many people, what I want you to do is you can call our office. You can schedule an appointment with myself. What we do is we offer 2 free visits. The first 2 visits, there is no charge. What we do is we sit down, you and I. We will talk over your condition. We will have you fill out some questionnaires and answer some questions so that I can get a better handle on what part of this equation might be causing the problem for you. We can sit down. We'll talk it over. You can tell me what's going on, tell me what's happening. I can try and figure it out. We can do an exam, a neurological exam, so I can see what's happening with your nervous system. And I'll be able to tell you, yes or no, I think this might be something we can help with. And if yes, we'll have you come back. I'll have had a chance to review everything by then, and we'll be able to put together a game plan. Look, yes, we can help you. If you're willing and able and you're ready to make the commitment, we will work together. And here's what needs to be done. Here's the plan. Here's the game plan. That's what we will do. I will offer you to do that. You can call our office. The phone number is 610-974-9911. Our email address, benedettochiropractic@gmail.com. You can feel free to call or email. On this site, there are areas, on this website, there are areas where you can leave your information. You can request more information. You can submit a request to have my office contact you to set up a consultation for the 2 free visits. If you're serious, give us a call, 610-974-9911, and let's see if once and for all we can finally end this chronic pain, chronic fatigue, this nightmare that you've been going through. Pick up the phone and give us a call. Submit some information if you'd like us to have us contact you. But let's get to the bottom of this and let's get it fixed. Thank you.